gëj a dem lopitaan pour nemmeeku sa wérgu yaram
ndax xam nga sa wérgu yaram fu mu tollu
est-ce que yaa ngi bàyyi xel si li ngay lekka
wala exercise bokk na si li ngay sóoraale si sa dundu pour am ci lu la leer toppaleen ñu leen di bu ne si suñ programme health check nga xam ne lépp lu ñuy waxtaanee dina méngoo ak sa wérgu yaram.
I am Dr. HASSAN AZADEH, a university professor in obstetric and gynecology at the University of the Gambia, and also clinical director at the MEDICARE Health Services. I have been asked to give some advice, give some awareness for childless couple in the Gambia. Unfortunately, we are having quite a large number of the people who became, for the rest of their life, eventually childless. But there are ways to identify the difficulty and the problem why a couple who live together, they are healthy people and they eventually end up not having a baby, not having a child. We call it in the medicine infertility or childless. And is this had very much dependent of the male and female. Infertility or childless is not particularly and only a problem for the women. About 28% of childless couple, the problem is not by women, the problem is by men. And we have, this is about 1/4 of childless couple, the causes we will find by male. So, by female, obviously, a female who has got regular menstruations and does not have any kind of other disease that can influence for her to get conceived. Those women, they also need to come forward to the clinic to be checked, to see whether they have any kind of sexually transmitted disease or any kind of things which eventually make them become infertile. We check the woman by our gynecological examination. We do a scan. We talk about the menstrual period, whether they have any problem with it or not. And once it has been checked, and the woman is actually does not have any kind of the disease anyways, to remain childless. Immediately we tell, you are actually okay because you don't have any problem, we check them. But you must bring your husband or your partner to be checked. To make a baby, need a male and female. Once we have taken care of the female, we go to the male. So the husband need to come forward for him, for us, to do some general checkup of the man about his health, if he's a young and healthy man. So we still do kind of test of eventually having kind of a problem with diabetes, hypertension, and once the man is being checked, we ask the man about his lifestyle. Do you drink? Do you smoke? And once he admitted not to do it, so then we concentrate on that couple and we have quite a fertility treatment. We have a fertility treatment to help male and female. One of the easiest way by male, we can do a kind of semen analysis, which we call it sperm analysis. By sperm analysis, we will see the quality, the number of the sperms, whether they are healthy or they are unhealthy. Because if there is a problem with the sperm of the man, once it's been diagnosed, and thank God again, in the Gambia, we have the treatment to treat female infertile or male infertile. So the male, eventually we can put them on some male hormone, which we call it testosterone. And we have done, and we do this kind of the checking of the infertile woman couple almost every day. And we can see the success for those one who came forward, both of them, and they got this kind of examination and the advice and the follow-up of them, and how happy they are after sometimes remain childless. And within 3 months, women can get pregnant, yet they can start having a family. We have a lot of success by that. But we only can help if for the infertility, for childless, both come forward. There are some disease, some medical disease, which can eventually influence the process of the conception. One of them is diabetes. When the man or woman suffering from diabetes, they may eventually have difficulty for the woman to conceive. But again, if they come forward, we diagnose them and we can see if the couple or any of them, they are suffering any kind of those disease, they should not just give up and say, because I have diabetes, I don't think so my wife can get pregnant. If the woman thinks of diabetes, no, I cannot conceive. Yes, there might be some cases if those disease, like heart disease and hypertension and diabetes come to quite a high level, then those cases possibly they might not succeed in getting. But everything should be checked. You have the chance to go to the clinic. You have a chance to see a doctor. You have a chance to be investigated. And once it's been done, you will definitely succeed. Don't give up. And just give up if you're drinking. Just give up if you're smoking. Those kind of avoidable habit, change them and get normal to the good lifestyle. And I promise, we are treating you, we are there to help you to start a family which you've been looking forward for a long time. Yes, there are some disease also can make the female infertile. Once they have the growth of a tumor, we call it fibroid in the womb, that can also cause infertility. And one thing at both sides, it can definitely infertility, is sexually transmitted disease. By sexually transmitted disease, the germs, the bacteria by women, they're passing through the womb and they're blocking the fallopian tubes where the conception takes place. Once those tiny organs are blocked, so the woman cannot get pregnant. And by men also should, if the sexually transmitted disease confirmed, need be treated. And I'm warning you, there are some sexually transmitted disease which can affect the unborn baby. And those diseases, like gonorrhea, if the man comes with a gonorrhea and transfer it to the pregnant woman, those bacteria can affect the baby. How many times we hear that baby has died inside the womb? Investigation shows that those couples, either both or one, had either gonorrhea, not been diagnosed, and syphilis. So you can see that STIs, sexually transmitted infection, they can also cause, and in fact, to be honest, in the Gambia, by statistic, sexually transmitted infection is the main cause of childless in the couple. They know about it, but they can't find about it. We are there, clinics are there, facilities are there, medication are there. You have to come forward. And if you've been diagnosed of any of those diseases, yes, we can try to treat male, we can try. And in fact, I give you a better advice. Before you're intending for the woman to get pregnant, the best way is to come to the clinic and to the complete checkup of the man and of the woman. Once we find out there is no sexually transmitted disease, she has a regular menstrual period, she doesn't have a fibroid or anything can eventually affect her getting pregnant, then we give them a lot of advice for their life, even the sexual advice, and those advice they taken home, and you will wonder how many of them they came to this way, and happily women got pregnant and come back to with the baby for us to see. And in fact, they call us, this is your baby. This is not our baby, but this is a baby we have by advice and make them easy for them to make them happy having the baby. And what we really try in this kind of the health program, that's this kind of knowledge, this kind of awareness, they should be transferred to other. What we're talking today, if you have listening and you're watching and listening, you're absorbing this kind of information. Why don't you give this information to your sister, to your brother, to other men? Look, there is a way to be diagnosed, to be treated for childless couple. Once you transfer in this kind of information to anybody actually, then you see some of them they may accept and they become aware and they come to the clinic. And we are checking, investigating, give them advice and make them happy couple. So please, by listening and watching this kind of health program, which is all made for you to get aware, and please accept our advice, our information we given to you for your own, and also give it to others. How wonderful is in your life that you have been holding a baby in your arm, and it's been that baby only was possible because you came to the clinic, you get the advice, and through taking the advice, now you are a happy couple. I hope that you taking those advice we are given to you. And if you would like to communicate with me, I can even give you my WhatsApp telephone number. This is 777-777-4469. If you please send any question, any comment to this number, I promise I will reply. Once we communicate with each other, then you find a way to have answer of your questions, and then we are there, and other my colleagues in any clinic, they are there to give you Those advice I'm giving to you today and have the opportunity to give you by this health program. Thank you and have a good night.